What are the localized complications associated with the administration of local anesthetics? The most common complications are needle breakage, paresthesia, facial nerve paralysis, and trismus. Needle breakage may be prevented by never inserting a needle into the soft tissue all the way to its hub, unless it is absolutely necessary for the success of the injection, and by not using 30-gauge needles. The most common cause of paresthesia is surgical trauma to the nerve due to hemorrhage, edema, or direct surgical insult to the nerve. In the absence of surgery, paresthesia may result from direct needle contact, hemorrhage, or the actions of the local anesthetic drug. Though precise figures don't exist, 4% anesthetics have a higher incidence of paresthesia than the lower concentration drugs. Most paresthesia occurs in the mandible, involving either the lingual or the mental nerves. Most paresthesia is transient, lasting from days to weeks and in some cases months. On rare occasion, a degree of paresthesia may become permanent. There is no definitive management available for paresthesia. Facial nerve paralysis occurs when you deposit local anesthetic into the body of the parotid gland, blocking the 7th cranial nerve, a motor nerve to the muscles of facial expression. This most often occurs following the inferior alveolar or the Vazirani-Akinosi mandibular nerve blocks. It may be prevented in the inferior alveolar nerve block by contacting bone prior to depositing the local anesthetic solution. The motor paralysis lasts for the duration of soft tissue anesthesia of the administered local anesthetic. Trismus is a spasm of the muscles of mastication. It has many causes, but it usually occurs following the administration of multiple inferior alveolar nerve blocks on one side of the mouth in one dental visit. When the local anesthetic effect resolves hours later and the patient sleeps, the injured muscles go into spasm, leaving the patient unable to open or with severely limited opening in the morning. Trismus resolves over a period of days without treatment. If dental care is needed during this time, the Vazirani-Akinosi mandibular block can provide both pulpal anesthesia of the mandibular teeth and motor blockade to the muscles of mastication, thus allowing the patient to open their mouth.